we're back. And Dr. Bradley, Dr. Fajan, thank you both so much for coming in today for this important information you're going to share. We know you're both involved with helping access critical healthcare information for low-income Tennesseans. I'll start with you, Dr. Bradley. Tell us a little bit about your role as Chief Medical Officer for UnitedHealthcare Community Plan of Tennessee and what your responsibilities are in that role.
Sure, Amy, and first, thank you so much for letting us be here today to talk about this important subject. My role at UnitedHealthcare is to ensure that all of our members have full access to all the benefits that they have under the TennCare program, including the 300,000 plus children who have the benefit of good preventive care.
And a lot of these people probably don't even realize that they could have access to this care. That's key, isn't it? Communicating to those people.
It really is, and we appreciate the opportunity to get the message out, and we do it in multiple ways.
Dr. Fajan, what are your responsibilities as the Chief Medical Officer? You're over TennCare. Huge responsibility for you.
Yeah, well, I also thank you. It is a real honor and privilege to be here today representing TennCare. I'm the Chief Medical Officer for the TennCare program, and TennCare is our state's Medicaid program. We cover about 1.5 million citizens in the state of Tennessee. That's about 25% of our state's population, and about 2/3 of those individuals are children. So we cover about half the children in the state. And one of my main areas of focus is our early periodic screening, diagnosis, and treatment program, which in Tennessee we call TennCare Kids.
With TennCare Kids, are you talking about, from babies, from infants on up to what age?
Yes, so for TennCare Kids, for our EPSDT program, we start really at birth, and for our purposes, we consider children to go up to the age of 21. So the EPSDT program goes from birth to 21.
And a multitude of services, obviously. Can you go into a little more detail on the kind of services that you provide?
Really, we provide a whole spectrum of care available to kids from 0 to 21. And it starts with screenings, so we try to encourage children to get in for their appropriate screening patterns, and we follow the guidelines of the American Academy of Pediatrics, and those screenings usually comprise at least 7 components. It's a health history, physical exam, immunizations when they're appropriate, lab work, dental and vision and hearing screening, behavioral and developmental screenings, and then finally health education. So it's opportunity for parents or guardians or children to raise any concerns they have about their health, but also for their physicians or their healthcare professionals to communicate and to start a relationship that can continue from there.
And I read in some of my notes preparing for the show that kids should have as many as 12 checkups even before the age of 3. Is that right?
That's correct. We follow the AAP, the American Academy of Pediatric screening guidelines, and that includes 12 screenings up to the age of 3. And that breaks down to 7 in the first year of life, 3 in the second year of life, and 1 in the third year of life. And then basically every year after that up to age 21. So that's correct, 12 in the first 3 years of life.
Okay, now Dr. Bradley, back to you. What makes these screenings so vital to children? Obviously, you're laying the groundwork in a way, foundation for the rest of that child's life, I would assume. So if you could sort of expand on why these screenings are so critical.
Sure, I think it gives the parent, and as the children get older, a time to have a relationship with a healthcare professional that really sets the groundwork for their ability to manage their care as they get older. The reason there's so many screenings is that with children, teenagers, certain things present at certain times. So that if you have an exam at 1 month of age, there's certain things that might occur then, certain things that are on the mom's mind, sleeping at night, feedings. But if you go to 3 or age 4, there are different things that are on the agenda, both for the history and the exam. So I think multiple periodic screenings help the family establish a relationship with a doctor, but also help detect early in the course of events things that need to be treated.
And obviously, if you intervene early or diagnose autism, whatever it may be, early on, you can have a much bigger impact on that child and helping them develop, correct?
That's exactly right. So early diagnosis leads to early treatment.
Also, I wanted to ask you, are these screenings covered by insurance then? I'm assuming they are.
They are. So we cover those as part of the benefits. So the screenings are covered, as well as any conditions that are discovered in the treatment of those.
Okay, Dr. Fajon, when should a child get a TennCare Kids checkup? What's the age, the appropriate age?
Well, the screenings start really within the first week of life, and that's the 7 screenings that should occur during the first year. And then there's a pattern, a schedule that goes from there following the AAP guidelines. And so probably the most important thing is to develop that relationship with your pediatrician or other healthcare provider as soon as possible after the child is born, and then follow the schedule from there. And our physicians and pediatricians and providers across the state are very aware of our program and what is available. And so once that relationship is developed, you'll be able to continue with the same provider moving forward from there. And as Dr. Bradley said, our goal is not just to screen the children, but to identify opportunities and concerns and problems early on and try to intervene and treat those as soon as possible so that they don't become bigger problems down the road.
Two more things I want to touch on in this last minute before we wrap up. Where do parents take their kids for the well child screenings? And does a parent need to take certain records to those appointments? Either one of you.
So I think if you're new to a practice, take all the records you have, your immunization records, any records from previous physician or provider. So always helpful to get all the information there. The other thing I would say about what to take is take your agenda. This is your time as a parent or as a child or teen to lay out the things that you're concerned about. So write those down on paper and take that with you. Give them to the nurse when you check in.
And just take them to their regular physician, pediatrician or general practitioner.
That's right.
Okay.
We want every one of our TennCare patients to develop a relationship with their primary care pediatrician or other healthcare professional, and so we will help to encourage that and develop that relationship moving forward.
It is all about relationships.
Yes.
Thank you so much, Dr. Bradley, Dr. Fajon. Appreciate your time.
Yes.
Okay.
Thank you.
We'll be back with much more right after this.